Staying home and staying safe. Well, for more on, indeed, the strategies to flattening the curve and the rising cases, joining us in our Lagos studio is Dr. Kayode Adebayo, former Nigerian Medical Association Chairman, Lagos chapter. Glad to have you on the program.
Good afternoon.
All right. Now, we've had you, and this was the earlier cases that we were seeing in Nigeria, and now we're hitting the 1,000 mark. How do you feel?
Feel very bad, but obviously it is not, we expected it. Nigeria has enough time to plan for this scenario.
I think we have or we had?
We had, because this case started in other countries and we saw it, that it actually paralyzed all the healthcare system, despite the fact that they have better healthcare system than Nigeria. The most alarming part of this scenario now is, if you look at it very well, the rate at which the healthcare professionals are getting infected is alarming. Government is trying, there is no doubt about it. But there are some areas we need to look into critically. Most of the cases we have so far were referrals from private hospitals. In most cases, some of these doctors are not even aware there could likely to be a case of coronavirus infection. Now, when they had a suspicion that, oh, this could be a case of coronavirus infection, they called for test. They called the Center for Disease Control for test. It takes another 2 days.
In the same state, like Lagos?
It takes another 2 days before the test could be done, in most cases. Then results take another 2 or 3 days. Now, during this period, where is the patient? The patient is still in the private hospital. And as a physicians and other healthcare workers, you have to manage patient. Patient has respiratory distress, patient needs oxygen, patient needs this. You can't abandon the patient to die as long as it's still in your facility. So imagine a situation where a patient with the coronavirus infection is staying 4, 5, 6 days in a facility. Of course, we are not surprised that the doctors and the nurses and other care are getting infected.
Dr. Adebayo, we'll come back to you. Please stay with us. We need to go on a break. More on the COVID-19 pandemic when we return. Welcome back to the program. We've been talking to Dr. Kayode Adebayo, former NMA chairman, Lagos chapter. Thank you so much for your patience. You were talking about how susceptible healthcare workers are in Lagos, and you mentioned it takes about 4 days before they get a result from the NCDC confirming a positive or negative status of a patient. But shouldn't they take any patient coming in as a suspected COVID-19 case and then prepare, protecting themselves?
Yeah. Yes, but there are deficits in the system for now. About 70% of patients, we patronize the private practitioner first. And when you look at the current arrangement, the private practitioners are not fully carried along. A private practitioner does not have PP, does not have an isolation center in his clinic. Some run 3, 4 bedroom, even those that have a bigger facilities, because we've not faced a situation like this before. There's no provision for, oh, we could have a very contagious disease that we need to have a separate place, we should have a PPE. Then they are not even trained in that direction. You see, don't compare the private sector with isolation center. Isolation center is prepared for it.
Well, the Presidential Task Force has talked about accrediting private hospitals, private facilities for this.
Well, we are not aware of, maybe when the government published the list of private centers that are accredited, well, we know. But you see, generally, when we look at all the cases we have seen so far, they are from private clinics. And in a situation, this is a war time. We should see it as a war. If we see it as a war, we need to get all the soldiers ready. If we say, okay, the doctor, protect yourself, the nurses, protect yourself. No. It's like telling a soldier that, go and train yourself to face this war. No. The health regulatory system, the private hospital regulatory system, the pharma, they know all the private hospitals. They should get them along. In each of the local government, we need a center, a temporary isolation center, where we can evacuate these suspected cases from private clinic, where pending the time we get the result and evacuate them to the treatment center. If you keep keeping them in a private sector for 3, 4, 5 days, you are increasing this community infection. Here we have doctors and nurses, after treating the patient, go back to their houses. Whereas in the proper isolation centers, these healthcare professionals stay at the centers. So you have limited them from having contact with the people in the society. But a nurse that is exposed to an infection, enter a public bus, get to the house, mix with the children. We need to have an isolation center in each of the local government so that we can mop up this patient as fast as possible.
We understand that we have Dr. Deji Olaleye, a physician back on from Essex in the United Kingdom. Hope you can hear me now. Just to quickly get your point of view with regards to what health workers are going through in the United Kingdom in fighting the pandemic. In Nigeria, we're having over 40 healthcare workers who are positive with the virus. What's the situation there?
Well, thank you for having me once again. It's a similar situation, I'm afraid. We also have a fair number of health workers who have been infected, and some, unfortunately, quite a number actually, have died as a result of the COVID-19 disease. So I think it's just that the health workers will be significantly exposed, and there will be repeated exposure as long as you look after these patients. It's an unfortunate consequence of the epidemic itself.
Leader Sir Starmer said that the frontline workers are scared to work.
Well, these are unprecedented times. Many of us have not faced an epidemic or any disease of this magnitude before, where in addition to looking after someone who is significantly unwell, you face the risk of getting such an infection yourself. So I think a certain level of fear and anxiety will be there, and some of it is indeed healthy because it keeps you on your toes. But I want to believe that most of the people that I've seen, in spite of the fear, in spite of the anxiety, they are giving their best to the situation.
Do you think that perhaps if we extended the lockdown nationwide, interstate, that this would help prevent what we're witnessing, and that is the community transmission in Nigeria?
Well, you see, I think we should understand in Nigeria that we do have limited options, unfortunately. We have limited strategies. This is because of our limited healthcare infrastructure, the fact that we don't have the sort of ventilators, we don't have the novel therapies that are being tried to treat this disease. So our surest strategy, the most thing that we can do most aggressively to sort of fight this disease is definitely lockdown, enforcing social distancing. So I think probably we are 2 weeks behind. Maybe if we have suddenly enforced that nationwide lockdown earlier, perhaps the sharp rise we've seen over the past few days, we will not be having it now.
Okay, our guest also here mentioned the same thing, meaning that we shouldn't have taken the WHO's advisory to locking down as early as when the US did a lockdown, but yet they're the highest number of confirmed cases in the world.
Exactly. If we have done a lockdown much earlier, we could have gotten a better result. We would have been able to limit the community infection. You see, as it is now, there is war on ground. And what we are seeing now is just a preliminary phase of the war. You remember when Italy, New York were having less than 300, less than 400? We thought, nobody knew that the situation will be that bad. Now, sometimes ago, we're having 3, 4, no zero death for like 10, 12 days. But look at it now. The more we have cases now, if you look at the curve is really facing up now. So also the death rate is facing up. So now, this is the best time to tell ourselves now that really, really we have a big war at hand.
Right.
And at this war, that's what I'm saying. We need to get both the private and the public involved.
Right.
It is not a job we leave for general hospital or we leave for government hospital alone. No!
We appreciate your time, Dr. Kayode Adebayo, former NMA chairman, Lagos chapter. Thank you for joining us. Let's go back to Dr. Deji Olaleye in the UK. And this is, with regards to what we're seeing here in Nigeria. It's a vulnerable situation, essentially. But then how do you think perhaps that we can look at other measures we're taking, like disinfecting, decontaminating several other areas? Is this something that's also going on in the UK? We see several other parts of the world are trying to open up. Even South Africa, with its numbers, are also saying that they might be opening up businesses a little bit from May the 1st. What do you think?
Yeah, I think the timeline of the epidemic, depending on which stage which country is in, there's a certain point you get to when it probably seems that the cases are starting to decline. And that would show that 2 weeks earlier, there was a decline in the level of community transmission. So if you work with that, you can possibly predict, then going forward to say at a certain point in time, we can start to lift up the lockdown in phases. And what I mean by in phases is that the more essential services, the more essential activities are allowed to start, and there'll be a gradual return to life as normal as possible. I think it's a worthwhile strategy if you are at that point in the timeline of the epidemic. But before that point, it would not be a good idea.
All right, we appreciate your time. Dr. Deji Olaleye, physician with the NHS Essex London. Thank you for joining us.
Thank you.